All right, so pleasure to introduce Dr. Zahra Premji, Daniel Brendel Mozuk, and Dr. Herb Schutz. Dr. Zahra Premji, I've had the pleasure of working with in literature reviews, so it's nice to see you again, is the Health Research Librarian at the University of Victoria. Also know that she worked at University of Calgary as well. She is currently the librarian for Kinesiology, Neuroscience, Public Health, and Social Dimensions of Health Programs, and supports multidisciplinary health research across campus. She has expertise and experience conducting evidence synthesis reviews on a wide range of topics and has co-authored over 20 systematic and scoping reviews, including a Cochrane review and a series of reviews to support the 2023 consensus statement on concussion in sport. In addition, she led the implementation of the Evidence Synthesis Institute Canada, which is a 4-day institute to train librarians to support evidence synthesis reviews. Dr. Premji regularly partners with UVic researchers on grant-funded projects that include evidence synthesis and supports the health data needs of UVic researchers as part of advanced research services team. Her research focuses on characterizing and improving reproducibility and rigor in evidence synthesis reviews through adherence to guidelines, creation of training opportunities, and designing data management practices and workflows. So welcome, Dr. Premji, Zahra. Daniel Brendel Mozuk is the Geospatial and Data Librarian at UVic Libraries. He is also UVic representative for the Statistics Canada Data Liberation Initiative and the Inter-University Consortium for Political and Social Research. Daniel supports all disciplines and faculties with their data needs. He is a liaison librarian, specifically for economics, environmental studies, geography, and sociology, and regularly conducts invited guest presentations, workshops for these disciplines. Daniel works with researchers to create visual representations of data, particularly maps that convey both what and where. He regularly conducts workshops in the areas of geospatial data and applications. Daniel has received grants with UVic faculty in environmental studies and geography. He has published in several areas, including health, creates maps for other publications, etc. Daniel is the former president of the Association of Canadian Map Librarians and Archives and is the current managing editor for Western Geography, the academic open access journal of the Western Division of the Canadian Association of Geographers. So welcome, Daniel. Dr. Hubert Schutz is an associate professor, hopefully I said your last name correctly, in the Department of Economics and the academic director of Statistics Canada Research Data Center at the University of Victoria. His primary area of expertise is applied microeconomic metrics in the fields of public and labor economics. Dr. Schutz, his research focuses on various aspects related to self-employment and entrepreneurship, very important, including factors that influence the self-employment decision and the characteristics of entrepreneurial ventures. He has written numerous articles on the entrepreneurship and public policy, several of which have been published in leading labor and general interest journals. He has consulted for several government organizations, including the Canadian Departments of Finance, Employment and Social Development, and the Secretariat of the Panel on Older Workers on Self-Employment Issues. Welcome, Dr. Schutz, Herbert. My name is Dylan. I work as an assistant teaching prof at the School of Health Information Science at the Faculty of Human and Social Development. Over to you, Dr. Premji, Zahra.
Thank you, Dylan. Nice to see you again. Hopefully you all can see my screen and hear me okay.
Yep.
Hey, welcome to our session titled UVic Libraries, Supporting Researchers with Their Data Needs. As Dylan mentioned, my name is Zahra and I'm the Health Research Librarian at UVic. And I'm joined by my wonderful colleague, Daniel, who is the geospatial and data librarian. I will start off the session and then pass it on to Daniel. Before we begin, we would like to take a moment to acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. I myself was born and raised in Kenya, and I'm a very grateful guest here in Canada and now on these beautiful lands in Victoria. In today's session, we're going to first cover the data landscape, including challenges with finding and accessing data, before moving to discuss what health-related data sets UVic has in their collection, both subscribed and open collections. We will discuss how to discover what other universities have in their open collections. And finally, we will talk about how the library can assist you with accessing specific collections, such as those of StatsCan from the provincial government of BC, CIHI, as well as a broad overview of what data services UVic Libraries provides. In order to understand the data landscape or environment, it is important to think through four main questions. Who created the data? How is it being stored? Who is disseminating the data? And who may access it? While the options on this slide do not cover all of the possible responses to these four questions, they are a starting point. If we think about who created the data, it could be individuals, whether it's researchers or research teams, or organizations, whether it's governmental, non-governmental, corporate, nonprofit, and so on. How is the data being stored? This could be public, i.e. it has a public-facing entry, and sometimes this is a link to the actual data, but in other cases, it's just a link to the metadata for the data, and access actually requires additional processes, or the data may be private and there's just no way for you to get it. Who disseminates the data? And this tells you where to go searching for it. Often this is done either by corporations or organizations through their own websites, portals, or apps, or in repositories, which is where individuals are more likely to put their research data for sharing and access. And lastly, who may access the data? Just because data exists doesn't mean everyone can access it or get it. Data can be open and therefore accessible and usable by anyone, or it may be restricted and only accessible by certain individuals or through certain additional agreements. In addition to these four questions, we also need to consider who the data is about, as this impacts who can access it and how. If the data is about Indigenous peoples, territories, and ways of life, then Indigenous data sovereignty principles will apply. This means that you may or may not be able to access it, and the processes to request the data will be different. You will need to be aware of the principles such as CARE from the Global Indigenous Data Alliance and OCAP, which stands for Ownership, Control, Access, and Possession. And if you are planning to work with Indigenous data, each source for Indigenous data may have their own practices and processes for data access, and you will be able to find this on the specific organization's website. And lastly, you might want to consider the quality of the data. Of course, the word quality can have different meanings. Quality could mean the metadata and documentation that is included alongside the data, or could refer to the quality of the processes used to collect the data. Many repositories have minimum metadata requirements, but there is not a universal requirement that can be guaranteed for all data. Let's look a little more at who produces health data. The three data producers you are likely to come across are government, corporations, and researchers. Let's start by looking at data by researchers and some of the challenges around it. Researchers may or may not share their data. Some of this depends on whether it is sensitive data, whether they have permission to share the data and not just the outputs of the research, i.e. the scholarly articles, and whether they planned for sharing in advance. If they did, then it is more likely that they are sharing via depositing in a repository somewhere. This could be a discipline-specific repository, the institutional repository, the funder's repository, an open repository, and so on. Or it may be attached or linked in the supplemental information along with the scholarly output or journal article. And sometimes they may just say that the data is available upon request from the corresponding author. And this may or may not lead to successful access, as has been shown in the literature that many requests for such data access can be unsuccessful. How you access the data could be different. It could be free if it's an open repository, or it may be available via mediated access that requires you to send a request, or in some cases, you may even need to sign an agreement. Here at UVic, researchers do deposit their research data in the UVic Borealis instance and may work with a library to plan and prepare their data deposits. The deposits require minimum information and are checked for the metadata requirements before they are published. If the data you are looking for was created by corporations, the data may be shared or available either for free, or it may come at a cost and require a subscription or payment. This is common when trying to access data that is created by companies where the data is the product that they are selling, such as market research. Or it may be private information that the company is simply not going to share with anyone external. If it is made available, it may be findable on their website or through a data portal or application. And access could be free and easily downloaded, or may require a subscription in order to get a login, or may require purchase of a specific data set. For government-created data, the data may be private or public and could be available through the government website, through a specific portal, or in government publications. Accessing the data may be free and easily downloaded, or downloaded for a cost, whether it's the cost for the data itself or the cost of the service required to access the data. Sometimes it may also require an agreement or use of a specific data portal, which may not be open to all and may require mediated access with a representative. So what does all of this mean for health researchers? Well, one, data may be found in different places, and there really isn't one place to search to find what you are looking for. Two, the data may not be available to you specifically, even if it does exist. Three, the data may come with a cost, whether it's for the data itself, for the time or service, or sometimes even for the tools needed to use the data. Four, the data may be available easily with one click, or may require negotiating an agreement or a license. And five, lastly, the data documentation will vary based on the source, the creator, or collector of the data. The library can assist you with finding options that are suitable for your need, be it via direct assistance or through a referral. And this includes working through the considerations we've just talked about, searching together with you through a variety of sources, and suggesting the next best alternative if what you want doesn't exist or can't be accessed by you. And now I'll pass it on to my wonderful colleague, Daniel.
Oh, you're on mute. Oh, I think you need to test your mic. There's no volume, no sound.
I pressed a little button on my lap.
There we
How
go.
about now?
There we go. Yeah, perfect.
So thank you for all of you you've had a long day since 9 a.m. I planned to join you and had completely forgotten that I have a Young Canada Works geospatial intern starting today. So I spent the day orientating him. So sorry I couldn't attend some of your sessions earlier. It would have been fascinating to sit in on some of them. So, we think of data, sort of these big players, Statistics Canada, social sciences and humanities research, and the Canadian Research Data Network. But, there's geospatial data and there's other kinds of data as well. And there's also financial data. And you think perhaps that maybe this doesn't apply to health data. Well, it depends. I mean, there's company reports on pharmaceutical companies. There's their financials, etc. And some of them may actually produce some surveys in terms of health data. The library doesn't have most of these. The only one we have is Bureau van Dijk, because most of these they want to sell to an individual person, and the library believes in as much as possible to buy that it's able for anyone on campus to access it, not it just being for one specific terminal in one specific office. There's also environmental data, and I work with biologists, hematologists, etc., in terms of finding climate data. How does it affect people's health? Whether it's earth and ocean, whether it's temperatures, whether it's coming from Europe, etc., etc. So there's, these are many times are used in conjunction with health data as well. And then, of course, there's data that we sometimes don't think of as data buried in Library and Archives Canada or special collections or national archives. This could have some primary source materials from 40 to 100 years ago in terms of health data. And again, we help people or refer people to archivists at these different organizations. And earlier, Zahra clearly said that not all data is available. And recently, a colleague of ours with Zahra and I, wanted to know about some data for these BC clinics in terms of how many visits do these primary care centers or walk-in clinics get. I mean, this is not freely available. The Ministry of Health says, no, you're not going to get this kind of stuff. And many of you will know that a few years ago, into the previous government of Christy Clark, there was actually a suicide, and there was some people that were fired and such because supposedly those researchers, and they've apologized, the provincial government has apologized since, is that there was a breach of confidentiality with data. And so depending on who the data is coming from and how much personal information there is involved, it's very sensitive and not always easily accessible. And believe it or not, I mean, this is tree cover for here in the CRD, Capital Regional District. This is not sensitive data. And just in the month of July this year, a researcher had to sign a license agreement for tree cover data. So this is the extent of, it's non-personal data, and they still had to sign a license agreement. So Joanne Miller sent us a whole bunch of questions. And so we're going to go through these questions. And she said, what health related data sets exist within the UVic Dataverse collection? Well, that word Dataverse is kind of problematic, and we'll talk about that because there's licensed data in a Dataverse, and then there's open data. And licensed, it's accessible to you folks connected with UVic, but perhaps not the public. And then there's open data sets in UVic Borealis, and we'll talk about both of these. And then we have to talk about this word Dataverse, because Dataverse is simply this back-end open source web application developed by Harvard University libraries that many libraries, more than 100 across North America, use to store, preserve, explore, share, and cite the data. And so Abacus uses this back-end at UBC, Borealis and UVic uses this. So even though they're both called Dataverses, that's just the back end. It's what's in them that really sets them apart. And so we're going to begin with UVic Abacus license data. This is a consortium of the big 4 universities in British Columbia, UBC, SFU, UNBC because of their medical program, and UVic. And so we get a lot of licensed data from Statistics Canada. We also buy a few geospatial data sets. And years ago, each of us were serving these from our own individual university servers, library servers. And then we decided about 10 years ago, hey, why don't we just put it on one server, us big 4, we're called the BC Research Libraries, and we'll serve it from one place. And so that's all coming to us from UBC servers. Even though you're signing into UVic, it's coming from UBC. And so what's in here? Well, it's the typical Statistics Canada stuff. We'll talk about some of the micro pumps data files, the postal code conversion file, the postal code conversion file plus. There's geospatial data files in there. Talk about that a little bit more because there's, healthcare facilities. There's something called the Integrated Cadastral Information Society. and BC Assessment Authority. And you might think, well, how will I ever use Cadastral Information or Assessment Authority? Believe it, actually, health researchers sometimes want to see values of properties, et cetera, nearest utilities, in order to do some spatial analysis with depending on their geospatial needs. And so, researchers at other places and here have, proximity to parks and green spaces, healthcare facilities, how close is public transportation nearby? And then the postal code conversion file and the postal code conversion file plus to geolocate, because maybe you just get a postal code from a surveyor, from a survey participant, and you need to relate that in relation to the rest of Stats Canada's geography, whether it's a census subdivision, whether it's a census tract, whether it's a dissemination area, et cetera. And so then you may have to use ArcGIS and QGIS as some kind of geospatial software. So within this licensed data set from Abacus UBC, we get the typical microdata files, the Canadian Community Health Survey from 2000 onwards, the Canadian Health Measures Survey 2022, and you see some dates there, I'm not going to read them all out. The General Social Survey on Caring and Care Receiving. The General Social Survey is conducted on a regular basis, and its theme changes. And so sometimes there's a theme with time use, sometimes there's a theme with families. And in this case, there's a specific theme on caregiving and care receiving. There's a survey of older workers that was done. It's no longer done, et cetera. And those are the kind of things that we're getting from the licensed data set through Abacus. So then we kind of have to quickly talk about, and this will be the last slide in several slides from now before we turn it over to Herb, to sort of understand Statistics Canada's layout. So they conduct about 350 surveys. The census happens every 5 years, the Canadian Community Survey, Health Survey, the General Social Survey, and they produce master files for some of these 350 surveys. And Herb's going to take you through what's in the RDC later on, but that needs to specifically apply for access to get into those master files. So they originally produced public use microdata files, and there's only about 110 of those from the 350, from the 260, and that's what we're getting, the Canadian Community Health Survey, et cetera. About 2 years ago, they introduced real-time remote access. And so I actually have to write a SAS program in conjunction with a researcher's needs. We have to submit it through a remote, secure setting. We have to pass 4 to 6 security steps. And we're not still doing this against the master file. It's a subset of the master file, but that's only about 2 years old. And it's growing a little bit, but most people for me are using the pumps. And then you can use the pumps and you're accessing them through this, again, this UBC Abacus, through the license data. There's RDS from Stats Canada, there's SDA. These are web-based analysis programs. And then, of course, you can do work with these pumps in, in R, SAS, SPSS, et cetera. And then, of course, there's aggregated tables off to the left there. So how is the data documented? So another question from Joanne. So, if we look at survey of healthcare workers' experiences during the pandemic, this is over in the collection at Abacus, the license collection. And then you'll see in terms of the metadata, the versions, the files, et cetera. And so if we look at the next page, so that the data dictionary will be there, the questionnaire will be there, the public use user guide will be there. This is just an example. And then, of course, the data will be there and ready to download and use. She said, what's the quality of the data? And Zahra kind of talked about quality. Well, I mean, every sort of data set and researchers, some of them put out quality of search guidelines, as this one did. Some folks give you much less detail, and we'll see that in a second. And so quality is a very subjective term. What one person thinks you'd really have to is not what another person thinks, and you really have to look through the guidelines. So who can access this data? Well, really anybody who has an active UVic netlink ID and password. And other researchers across Canada, major Canadian universities, have the same Statistics Canada and all this access to these pumps. So whether they're from McGill University or Memorial University in Newfoundland or U of A, they would have access to this as well if you're working with researchers from other institutions. And so really that's the end of sort of the UVic licensed data sets. And then of course there's this Borealis collection that again uses the back end of Dataverse, but now we're working in conjunction with other universities across Canada. In our specific one, and we make this available, there's something in here called the Canadian Health Info. There's also a data set called the Behavioral Research on Aging and Illness in Neuropsychology, and it's coming from our psychology department here. And so again, how do they document the data? Well, they've got, in terms of their README text, as opposed to with the way Statistics Canada had a separate file for the data dictionary and for the user file, it's all in the README text. And it's it's not just a couple of lines, but they're putting all of that information with the variables in the data dictionary into the README text. The metadata is in terms of how the quality, you would have to actually go over to InfoWay, which is who produced the data in the first place, and be looking at their terms in terms of defining what quality is. And then if we go bigger than just UVic's Borealis, now suddenly we're across universities across Canada. And so there's approximately 62. And so this is where researchers at those universities, just like researchers here, have worked with the library, uploaded their data sets. Probably the step before that is they've created a research data plan, and we have librarians to help out with that, so that one day when they do want to upload their data, they already have a data dictionary created, they already have a user guide created, et cetera, et cetera. And so this now is for researchers across Canada, and actually many of them for the public across Canada can go and into Borealis and see these different data sets that are coming to us from all across Canada from researchers at these institutions. And so, you look into Borealis itself, and so you can do a subject search and see that under medicine, health, and life sciences, there's approximately 1,200 data sets. There's the old fashioned simply putting in the word health and putting an asterisk after it to get health care, to get health singular. That's just a truncation symbol that looks for, or a wildcard symbol that's looking for letters after the letter H until there's a space. So probably it's better to go in by subject heading than it is simply by doing a search with a wildcard symbol. But that's what you would see what would be in Borealis. And again, in terms of metadata, so the National Survey of Canadian Nurses, again from Health Info, this is coming from a third-party vendor, Canadian Nurses Informatics Association. So again, you'd have to go over to their site in order to see the quality of the data and read their documentation. Again, the data dictionary and the variables are in the README text, unlike separate files with the Statistics Canada's data sets. And then Joanne said, well, what about all these other folks, BC Stats and CAIHA and UVic, UK Biobank, or the Baltimore Longitudinal Studying of Aging, and biologists that I work with, Institute for Health Metrics and Evaluation, the Global Health Data Exchange. Currently, that's myself and Zahra. And we've also got subject librarians. If you're in psychology, you could probably contact the subject librarian. They may eventually refer the question to Zahra or myself. We are planning to hire in the future, it's a long way off yet, a librarian to support the Island Medical Program. And that person may take over some of this health data sets, but currently it would be Zahra and I. And then, we can't, Zahra hinted at this in terms of First Nations Health Authority, First Nations Information Governance Center, National Collaborating Center for Indigenous Health. I mean, these folks collect their own data, their own surveys. It's their data. Most of the time, you probably there's a few open data sets that they make available to the public. Unfortunately, they're often a static PDF. It's not coming to you in a spreadsheet, CSV, or a tab formulated, or a DTA. And so to get more, you would have to contact them directly. I've done it on behalf of folks sometimes, but really I say then I become a middle person. So I say, listen, why don't you just contact them directly and let me know how it works out? And then, you folks had earlier sessions on all of these folks. And again, we have helped point people to these things. And what we offer is some of these folks know only about their data sets. We're familiar with the wider landscape. And so depending on people's needs, we point them to the appropriate places. And so again, we talked about this just a few seconds ago. Who can help you with your data needs? That's Zahra and myself. We've got a whole team in terms of called Advanced Research Services. And we've also got, tools and workshops. And so we offer, workshops on R and R Studio and cleaning up data and Open Refine. And we've got, the UVic campus has access to SPSS and SAS through UVic Computing Services. We also offer research data management in terms of planning. We offer services on tagging your data sets and then doing some qualitative data analysis within Vivo. And, Zahra does covidence workshops, and there's Tableau to visualize, and then I do geospatial workshops. So there's all these kind of folks that you can turn to in the library. And so this is the slide I had earlier. And at this point in time, I'm going to turn it over to Herb. I'm going to stop sharing because he's going to talk about what's in the RDC. And let me just stop sharing here for a second.
Is my screen sharing?
Not yet.
Not yet. Okay.
Maybe make Zoom big screen, and then at the bottom will be a green button that says share screen, Herb.
It's asking for my system preferences for some reason.
Oh, okay.
Herb, if it's easier, I have your slides loaded up on my system. I'm happy to share them on your behalf if you like.
If I can make this work, I'd like to make it work because I was going to go to a web page.
Of course.
Let me just try it here just a second. Okay, let's try this again. Share screen. Desktop. Share. Okay. We may have to do that.
Sure.
I'm not sure what's coming up. It's giving me screen recording, Zoom, share. So is this yours that's coming up now?
This is mine. And what I'll do is
Okay.
I will give, didn't mean to press that. I'll see if I can also give you your, no, I won't be able to give you remote control access, but you can just go ahead and say.
Yeah, okay. And then what I'll do is I'll just ask you to click on one link at one point, and then we should be good to go. Okay.
Sounds good.
Well, okay, sorry for that. Dylan, thank you for the introduction, and Daniel and Zahra, thank you for putting the RDC in the context of data availability at UVic. I am the academic director at the UVic Research Data Center. We're part of an umbrella group called CRDCN, which is the Canadian Research Data Center Network. And so they sort of coordinate and oversee all of the things that we do at the RDCs across Canada. Okay, so if you can hit the button, that'd be great. Okay. So I want to talk a little bit about the RDC. The RDC provides data access to primarily Statistic Canada, but we'll talk about some of the other data that's available through the RDC as well. It's microdata, and so that means that it's not aggregated to any extent. The other thing about the data is that it gives you highly detailed information that's not available for public, that's not available in public use data. Okay, so you're accessing data that's not public use. It's confidential data files that are available through the RDC. What makes it confidential? It could be the level of detail that's available. It could be that it's administrative data like tax data that's highly confidential. Oftentimes in Canada, at least, what makes it confidential is in part of the idea that it's longitudinal. You can follow individuals or households or firms through time. That tends to make it confidential as well. That data is available for use. We'll talk about how you access that in a moment through a secure facility that's available here at UVic. So you're able to access that data and work with it. So it's not aggregated at all. You're working with the very detailed microdata and creating any of the output that you want. So you'll have to do that on your own. The data is protected in a number of ways. Although you get a lot of detailed information, so things like individuals' names and other information that would allow you to identify an individual, a business, or a household is removed from the data. But outside of that, you're able to access the data. Outside of the data access, CRDCN also provides a networking for researchers. We put on conference each year. CRDCN also helps with dissemination of your results and your data results. Okay, so next slide. What kind of data is available? What is the subject areas of data? Well, I've highlighted on this slide, of course, health. But there are a number of other subject areas that are available. And what we'll see is that now in particular, there's been a lot of work done, StatsCan and at the RDC, to draw linkages between the various subject areas. So health, children and youth, for example, health, immigration, health and older workers, for example, health, income, pensions. So all of these are starting to become more linked together. And so the subject areas that makes it up for a very broad subject area if you're working in a particular area. Next slide. Some examples of data that's available. So my area of research is labor economics, so I'm less familiar with health data. So what I've tried to do is to give you some examples here. And when we click on the link here, I'll try and give you an idea of the kinds of data sets that are available for your research. And then, of course, you can always go off and search for yourself. So we have different forms of data. We've got survey data, so things like the Aboriginal People Survey, Canadian Community Health Survey. Again, these are the microdata files with confidential information included in them. So we have survey data. We have more and more common in the RDC is administrative data files. So things like the Canadian Cancer Registry, Canadian Birth Census Cohort, tax data, for example. All of these are becoming more and more available in the RDC, things like the Longitudinal database. Along with the extension of administrative data to the RDC, as I mentioned earlier, there's been a push and, in fact, a movement towards linked data, both linked survey administrative data, but also linkages between different administrative files. So one of them that I've highlighted here is the link between the Longitudinal Administrative Data Bank, which essentially includes tax data files with the Discharge Administrative data bank. So those files have been linked together for individuals so that you can obtain information not only on discharge information, but also longitudinal information on individual tax files or anything that's included in those tax files. Other examples are linkages between the discharge admin data, Canadian Community Health Survey, and IMDb. So you see these linkages across several different, not only survey, but administrative data files. So if you could click on the link there that says 200 data sets, then that'll bring us to the CRDCN webpage. It should.
Oh. Okay, it took me there, but it didn't take you there. So let's try that again.
When you shared, did you share all, or you may have just shared the PowerPoint? So you have to do share all if you also want the.
There we go. It came up there just a moment ago.
It did, hey? Okay, let me try.
Yes, it did. Yeah.
Maybe it just took a moment to.
Yes,
Okay, let me see what I can do really quickly right here. If anything within the Zoom, it's
there we go. Oh.
Oh, now that's not meant to be it, is it? Is it actually?
It came up there just a moment ago.
Maybe it's just taking a really long time to load.
It seemed like it just came up.
Watching it on the second screen as well, so I can see what you're seeing. Not seeing it.
Can you maybe?
Sorry.
It's probably opened in a browser, so you click on the browser that you think it opened up in, and then it should be there.
Maybe if you give us the link on the chat, we can all just click on it.
There you go. I'll do that. Good idea.
There we go. Oh, no, this is not it.
All right, I'll put the link in the chat for everybody once the screen share is down.
Okay, I'll just move ahead then. If you click on that one, on that link, and it'll be available later on. What you'll see is it'll take you to the CRDCN webpage, and it'll take you to the data link actually. And if you scroll down a little bit, there's an area where you can click in or just search by subject. And if you search health, for example, it'll give you a list of health related data files and linkages that are available for you to download or to access in the RDC. So that's one way to access the data. Another is directly through Statistics Canada webpage, and I'll make that link available as well. I was hoping to show it here. And what I like about the StatCan data page in particular, when it talks about the link to Research Data Center data, is that when you search, you can search for specific data files. So if I were on that web page now, I could include something like DAD, if I was interested in linkages between DAD, and all of the files that are available that are linked to the DAD, whether it's survey, linked to DAD, or other administrative files that are linked to DAD would come up, and you'd be able to see the kind of data that's available. Now, one of the questions that was asked was what kind of documentation is available for the data, and there, I think, especially for the administrative data, the information that's available is a little bit sparse. The survey data is pretty straightforward. We can find the data dictionary, for example, and that's easy to find. The more difficult part is typically with the administrative data. There's just no survey that's been conducted. There's no clear file that you can click on that's going to allow you to give you all of the information. And so if you're interested in the data, you can reach out to me and I can give you an idea of what's available in those data files. Okay, if we can go to the next slide. Okay, this is just an example of these are some examples of the research that's been conducted using data in the RDCs. And so if you're interested in the kind of work that's been done in the RDC, this gives you an idea of the kinds of things that can be done with data in the research data center. Okay, if we continue on. Okay, let me talk about, this is the key point, where the research data center is and how you gain access to the data center. Okay, we are located in the library in the basement in what is essentially a little bunker. Well, not a bunker, but a room with no outside windows. Access is secured. And so the way in which you access the RDC data is through a series of steps. The first thing to do would be to make sure that the project that you're working on requires RDC data. And so the way that you would do that is to go and check and see whether the data that you're looking for is publicly available. If it's not publicly available, then chances are you are going to require access to RDC data. Is it longitudinal in any way? Is it detailed information that you're looking for on individuals? In that case, then you're going to require access to the confidential data files. Then what you'll do is complete a project proposal, and that is available through the RDC website. And so it's RDC linked to the StatsCan application website. You fill out a project proposal. And the key elements to include in your project proposal, what it's being vetted for, is just to ensure that you're accessing data legitimately, that this is data that legitimately requires access to the confidential files. So you'll write a proposal, include any methodology that you're using, along with the data that you're needing and why you need the data, most importantly, and just making sure that you're convincing the reader that this is data that you need access to the confidential files. The data is available to faculty members. It's also available for students. Students also require a letter from their supervisor in order to access the data. So they have to not only submit a proposal, but also ask for a letter from their supervisor indicating that the supervisor will be there in the data center to assist if the student needs it. Then you upload your documents to the microdata access platform. You wait and get a response from Statistics Canada. Somebody will review your project proposal, and you'll get an indication as to whether or not you've been granted access to the data. Following that, once you're granted access, you need to have a background check done, which can take a little bit of time. And then once the background check is done, you're sworn in as a deemed Statistics Canada employee. And after all of this process, you are able to enter the center and gain access to the data. So is it a long process? Yes, it's a bit of a process, but it is confidential data. And so you need to jump through these hoops in order to be able to gain access to the data. As I mentioned, it's available to students. Is the process too onerous for students? It depends on the situation for the student. For PhD students that are working on longer term projects, definitely doable. For master's students, depending on the length of the program, the time to access the data, which I would say on average takes around 3 months, just might be prohibitive for those students. And certainly if it's a single term course, obviously then accessing the RDC data just wouldn't be in the cards for those individuals. There's no charge for faculty and students at UVic. The VP Research and a number of departments kick in money to support the RDC. Okay, next slide, please. Okay. As I mentioned, working in the RDC, it's a secured location. You require a swipe card to get in there. There's restriction on the use of cell phones and laptops. You're not allowed to use them in the center. Workstations are provided, and you can book those ahead of time so that you make sure that when you're in the data center, you have access to a workstation. The workstations include all of the information that you need, all of the software that you could possibly need, SAS, R, stat, all sorts of stat programs, including Stata. And so you book ahead of time, you work on your project. The data stays in the center, so you cannot remove it initially. All output must be vetted before it is released. So you prepare the data for vetting. That goes through a vetting process. And then once the data is released, it's sent to you outside of the RDC. One of the restrictions currently at the UVic RDC is that we are a part-time center. So typically we're open 2 days a week, 8 hours each day, and we have some flexibility in terms of the days that are available, but that can become a bit of a restriction. The good news is that something called VRDC is coming. It's planned right now, at least, for the second quarter of next year. And this will allow researchers to work from your office, either at UVic or at home, on your own laptop, on your own computer. Of course, you still have to jump through all of the same hoops, but the data will be secured on your individual laptop or computer. You'll simply access the data through a secure network. Currently, about 80% of current projects that are conducted at the UVic RDC would be eligible for VRDC. That would allow you then to work at any time of day on the data. Okay, last slide. Okay. If you want to find out more information about the RDC or CRDCN, click the link to the UVic RDC page and have a look around. All of what I've discussed here is there. There are links to the data through the CRDCN, so that if you're interested in finding out what kind of data is available, health data is available, you can link and search through yourself and see the kind of data that's available. Okay, thank you for your time, and I hope to see some of you in the RDC.